Hi, Noah.
Hey, Kodee, how are
See, that's one of the great things about this meeting, and one of the less good things about this meeting is every time I have this meeting, I look at about 4 people that I owe emails, and I say, "Oh yeah."
Ooh, about that.
Yeah, I do know about that.
So we are at noon. We're probably going to get a couple more people here as we go through, as is kind of our thing. A minute ago, I saw, oh, there he is. Billy Croslow, excuse me, won the William L. Stamey Award for Graduate Teaching Assistant this year from the College of Arts and Sciences. So Billy, just wanted to recognize, nice job.
Yay, congratulations.
Thank you so much for everything you do for students. It's awesome. And lots of other cool people won too. We featured them on our social media this week, so check them out. Anyone comes in, I'll embarrass them by congratulating them in person too if we see them. But people are doing awesome work. Those awards are so competitive. It's really a big thing to win those. So thank you so much for everything you do, Billy. We also have another person here who does a lot of stuff for us on campus, and I'm going to introduce Dr. Walls here in just one second. Before I do that, I'll remind you that we have a professional development series every Wednesday at noon, except for next Wednesday, because we all should be doing other things besides school and work and all of that next week. But in 2 weeks, we will have Fred Burak, our director of assessment, who will be doing one on assessment and talk about assessing in our classes and those kind of things. So we're really looking forward to that. But before we get there, we get a really important one today with Dr. Kodee Walls from Counseling Services, who's going to talk to us about our students' well-being. And I'm so excited for this. As I had mentioned to Dr. Walls at the beginning of this when we were chit-chatting, there are only 2 people who present in this series every semester, and that's me and that's Dr. Walls, because our students' well-being and our well-being is always a timely topic. So without further ado, please join me in thanking Dr. Walls for being here.
Thank you so much. I appreciate that. And I love seeing familiar faces and familiar names. And for those of you who have been at these presentations with me before, I definitely want to create space for you. So don't hesitate. The norm I prefer is, like, if you've got a question, ask. I will do my best to keep an eye on the chat, but I might miss it. So feel free to unmute yourself and just say, hey, I got a quick question, and we can make that happen. But before we do that, I actually want to take a chance to really invite us together into this virtual space. And I really like to do that by just a little moment of mindfulness. So if you want to participate, you can definitely do that, but you don't have to. I realize there are screens off, and it's really easy for us to do 2 or 3 things at the same time. But just at least for this moment, I want to invite you, if you'd like, to close your eyes. And let's just settle into the chair you're in, or if you're standing for this meeting, just really notice your feet on the ground. And just allow yourself to take a nice deep breath. Let's do that once more. Take a nice deep breath. And I want you to allow yourself to experience some of my gratitude that you have made time to come to this presentation, and that I hope it's really meaningful for you. And that you know that I'm here for you to help support you in all of your efforts, just as I am for students. And let's take one more deep breath in and out. All right, and when you feel ready, you can open your eyes. All right, so as is the way, I'm going to share my screen. And I can, oh good, I can see you on the side. So the big thing, so in the past, right, we've talked about, for those of you who have been at these presentations, talked a little bit about like stress management perspectives. And so I wanted to take this a step forward and really discuss how to integrate mental well-being and holistic well-being and the whole student into the academic side of things. Because obviously, Counseling and Psychological Services, which we had a rebrand, by the way. So CAPS for short. We are your K-State Community Mental Health Center. And sometimes, right, if you know mental health professionals, the community mental health center language can feel like a dirty word. But I think actually we can kind of take back the language around it, because we are part of this community, and we're a resource for everybody. But because of that, in the confidential nature of our work, I think we often inadvertently become siloed away from the academic side of things. And but in reality, you all have way more contact with students than we do. We maybe, if they're in individual therapy, have 1 hour once a week to every other week, but you have them, if they're going to class, of course, or you have meetings with them, you can be with them up to 3 hours or more each week. And granted, you're holding a lot of other people in that space, but you have a unique opportunity to connect with them in a way that we don't. And you get to see kind of a spectrum of wellness. So maybe you can see a decline of a student. And I want to definitely kind of empower you to get some ideas of what some of those things can look like if you haven't seen that already. But you had that data point, right? Of like, you were coming to class, you were turning in assignments, you were participating, and slowly I noticed that changing about you. So what's going on and how can I help? So what I hope we'll talk about today is how to identify pink flags for distress that are unique for your students. And that can be the graduate students you're advising, the interns that you're perhaps working with, the students who just happen to walk to your room or to your office because you look like them and they feel seen and heard and understood because there's some cultural connections with you because of that. But start to notice it before it becomes a crisis. Also talk about options to integrate mental well-being into your curriculum. And I want to encourage all of you, because I saw Emily Maley, right, in kinesiology, and there's an exercises medicine, and there's a lot of richness in there. But how do we think about something like physics or ag econ and integrating mental well-being? So want to create some opportunity for flexibility in your own thoughts about that for your classes. And then in that process, we're going to create your own personalized starting place for your well-being, or integrating that well-being content into your courses. So to talk a little bit about, thanks Melissa for the feedback about the mindfulness exercise. I'm glad you appreciated that. So I want to give you a little bit of the mental health landscape in higher education. So the National College Health Assessment, or the American College Health Association, does a National College Health Assessment twice a year, once in the spring and once in the fall. And so we have some of this data collected from across the nation, and I have the specific, the number of participants in this, and then it gives you a little bit of a breakdown. So I do want to talk a little bit about what this Kessler 6 is. So the K6 for short is a 6-item inventory rated on a 5-point Likert scale. Throughout the process, it's a truncated version of a 10-question item, but basically it's just a global measure of distress for depressive and anxiety-related symptoms. When completing this form, it doesn't mean that a person has depression or that they have generalized anxiety. It's just a sort of a starting point so we can get a sense of what's going on for the students. It was originally developed in the US for Substance Abuse and Mental Health Service Administration, or SAMHSA, and to give us an accurate estimation of the prevalence of serious mental health concerns. So the NCHA uses that as a metric when asking questions about mental health care. And they also cover a wide variety of just well-being and wellness, like sleep, substance use specifically, how connected they feel with campus, and how meaningful things are. So if you look at some of these numbers, the thing that I want to highlight the most is that the majority of our students are doing okay. I think sometimes it benefits certainly under-resourced service units like mental health care to continue to proclaim that we're in a mental health crisis. We definitely are under-resourced, and we can always use more clinicians, more funding, more opportunities, and earlier intervention activities. But what it does is it doesn't take into account that most of our students are doing pretty okay. Now, with the exception of our trans and gender nonconforming, gender fluid students, they tend to struggle a little bit more than cisgender, which are men and women who are folks whose biological sex and gender identity are congruent. And a lot of that has to do with transphobia throughout the United States. It could deal with feeling disconnected and self-isolating because they don't feel like their congruence will be or their incongruence will be accepted by others. So they tend to be a higher need population just because, unlike communities of color, for example, where racism is a reality, they at least have their family to connect with. But lots of times trans and gender nonconforming, which is what that GNC stands for, they don't have families who are always supportive. So they don't have that support system to lean on as much. And that's fair, Melissa, to see that on average 20% for students in a class of 20 feels like a lot to you, right? I think that's a really good point. So this is a landscape overall. And then I wanted to also highlight graduate students, because I feel like we miss out on this population a lot. So I wanted to share some of these things. They did not pull, they kept it the 2 categories of sex for male and female, and they were looking at that information. So here's a little bit of data for graduate students. Again, same Kessler 6. And they did not also parse out what the male and female participation in this particular study as graduate students looks like. So again, 65%, which is more than half, are having no or low scores on the Kessler 6. And then we sort of do creep up in moderate and serious. And the N is much smaller, right, compared to the overall number of participants in this. But I was actually surprised by this one, that there weren't more graduate students saying they were in moderate or serious psychological distress, which perhaps speaks to my experience in grad school. And I had a great program too. So anyway, just wanted to hold that information. Any questions about it? I see Melissa and Andy talking. Did you want to share any thoughts or process anything, or are you feeling good in the chat?
I'm feeling, I mean, I just wanted to, I was noticing with the data that it, you know, it's nice that not all of our students are experiencing a lot of distress, but still, you know, about half of the students are at moderate to serious, and that's not nothing. So
yeah. And I also, because my interaction bias is that I only see students who are in serious distress, right? Like I teach an online stress management class, which of course the psychologist, the clinician psychologist does. But, but to know that there are students who are like mostly doing okay, and it's just small tweaks, to me feels like there's still hope for our like existence and community. So yeah, but I definitely appreciate that perspective. So yeah, that's also true, Don, right? Self-report, underestimate these things. Oh, good. Okay, Melissa. So Andy spoke well. Great. All right. So I want to do a little bit of a breakdown for what's happening specifically at K-State. So we participated in the ACHAnchd data collection in the spring 2020. So part of the questions, I've got a bug on my glasses, was that in the questions, at least 30 days before completing the survey, did you experience the following? So at least some of the time. So 72% of the students who participated felt that everything was an effort at least some of the time, which thinking about everything could be getting up and eating something. Yeah, that's before the pandemic. Imagine what it's gonna look like now. Getting up and eating something. So like nourishing our bodies, moving our bodies in a meaningful way, getting quality sleep, having difficult conversations, connecting socially. Like if everything is an effort, it's going to be really easy to not take care of our basic needs and to disconnect socially. 57% felt hopeless at least some of the time. 49% felt so sad that nothing could cheer them up. And 40% said they felt worthless. So how do you imagine this was impacting them academically before the pandemic? And feel free to unmute. And if you can't use your mic, then definitely put in comments. So Melissa posted a question. Do we think that students are experiencing these things more often, reporting them more often, or both? And that's a really good question. And I think the response is it depends. I think that the destigmatization campaigns that have been happening for many years now across the country at all levels, K through 12 and college, have empowered students to be more honest about their mental health issues. So they have an increased willingness to make known on a survey or in help-seeking behaviors that they are struggling. Were these feelings predating college? Sometimes, right? Like it could have been in the last 30 days, like maybe pre-college people, we maybe transferred in the spring semester for this particularly, but that's possible. Oh, there was another point, sorry, it just escaped my brain. It'll come back to me. Summer, you made a really good point. Hope is directly related to motivation. Exactly. and self-efficacy, right? I believe I can do this because I've done it before. But if I'm feeling hopeless, it doesn't matter what I've been able to accomplish. Oh, one last thing. This is what it was. The proportion of demographics for folks that completed our ACHA NCH data was, I think 60% or more were female. And so we're getting, and most of the time females in the United States are more comfortable engaging in help-seeking behaviors. And just to remind folks, my question was, how do you think these sort of things impacted the students academically? That's a really good question, Walter. So similar trends across departments or depends on the department. They didn't, I don't know that they specifically parsed out the major or the programs for people, but I can look more into that and get that back and get in touch with Dawn and Noah and see if we can get you that information. So Melissa had an experience, a cis male telling her about his mental health struggles, and he said he told no one else. That happens very often. Which then, what the hell do you do in that moment? Because you're very likely not a trained professional, right? So you're suddenly holding this and you don't want to violate the trust or the relationship with them by like referring them, but it feeling like you're pushing them away. But there, it also takes a balance, right? Like you can't, it's unreasonable to expect of yourself to be the one that can hold all of that. So. Right? The more you feel, the less you think. If any of you were on board for the bandwidth conversation a few semesters ago, this directly relates to that. When you don't have space because you're trying to deal with just getting out of bed and not judging yourself, you're probably not going to really care if you're turning in your literature review paper. So got some really good things happening in the chat, but I want to be mindful of our time because I always run over with these. All right, and another piece that I think is important, and I forgot this slide was next on my question about impacting their academic performance was almost like I'd done this presentation myself. So top 6 impediments to students' academic performance included stress, which is really a nice umbrella term for just like not doing well. Then the anxiety, depression, sleep difficulties, headache, migraines, and then upper respiratory illness. And again, this being before COVID, like that's really fascinating to me, of people just like getting colds. You don't have to like throw this up in the chat or put an emoji in your picture, but how many of you in this past year have noticed you've had more headaches than you've ever had before in your life? If nothing more than just being cramped at your desk and not having the opportunity to like walk between meetings, right? I know I have. And so I have to be really mindful of it when I've noticed that I'm like sitting cramped. I'm like, you haven't moved in 2 hours. That's probably not good. So same things happening for students, and just stress headaches can be really part of that. Sleep difficulties. We could have a whole presentation of why sleep matters. And there's an entire book called Why We Sleep. Definitely encourage you all to read it because you will get a good understanding of why only getting 5 hours of intermittent sleep is actually really detrimental for you. And sleep hygiene can be so impactful. So I think, LaBarbara, I want to amplify your comment a little bit because you shared you had more students with stress quickly in the semester. And I think that has been a trend that I've been noticing too. Like before, right? Maybe October, we're starting to see some drop off or people talking about struggling. But I know from lots of the folks I've been talking to, it's like September. It's like, how are we going to get through 3 more months of that? So, LaBarbara, did you want to add anything?
Yes, we teach a very rigorous discipline in the first place, and it's a
Right.
professional program. And studio is a real difference from what they've had as an experience. So we anticipate that our students are going to be stressful at the unknown.
Mm-hmm.
But as faculty, every Monday, we have a conversation about our students, and more of my faculty have talked about the issues of anxiety, depression, and some of that sleep difficulty, but
Mhm.
but they are ready to bail out. They don't even know why they're there. They're
Mhm.
feeling like they're not capable, no matter what, that the perfectionism in them just doesn't work.
Yeah.
Really, I mean, it's and we instituted a wellness day
Nice.
in our program this fall for a freshman in
Mhm.
particular. But coming back, they were still struggling. And we've noticed a quick response of struggle again in a
Mhm.
very short cycle, very short cycles.
Yep.
So,
Mhm.
I'm not sure what the answer is to that.
Mhm. Mhm. Yep. Those are really great observations. Thanks for sharing. Um, all right. So I want to shift to, this is the like pink flags bullet point for this next section. So I just want to offer you some symptoms that are typical. And again, these are not, I'm not wanting you to try to become a mental health provider. These are just some things that maybe you've noticed in particular in your students, or maybe yourself or the people that you love and care about. And it could be a good opportunity to create a conversation around, you know, beyond just self-care and that like that treat yourself self-care kind of thing. Because I think when we think about it, we assume self-care is comfort, but many times self-care is doing the thing that we need to, getting out of bed, maybe making our bed, not wearing our jammies all day, going and drinking a glass of water instead of having that second double shot Starbucks. Maybe it is, you know, choosing to eat like a more well-balanced meal instead of a Hot Pocket, right? So those things are as important as self-care as going and getting a pedicure. So I listed on these two columns, right? Burnout is one I think we will most often see and probably have experienced ourselves to some degree or another, right? So exhaustion being part of that, and related to sleep problems. And so that's difficulty falling or staying asleep and not feeling rested even after quote unquote enough sleep. Cynicism, this is a big one. And this is where I, as a mental health professional, keep a real temperature check on my staff. So if I start hearing a lot of descriptions of frustrations about clients, which they're going, like, this is not anything personal about if you've done therapy and your therapist maybe has had some or given you a vibe of frustration. This does not mean that they don't care about you. But if it feels that way, maybe it's a good idea to find a different provider. But when we're just sort of talking with less compassion for the people we're working with, and that cynicism, I think, is a good sign that, hey, I've noticed you haven't taken a day off in a month and a half. Maybe it's time to do that. Feeling useless, hatred of what we're doing. And I feel like this is such a powerful idea of not only, you know, perhaps feeling useless, but just like, what's the point? I don't get it. It doesn't matter anymore. Which then can also look like easily frustrated. So snapping at ourselves, or like our significant others, maybe our children, our pets, our coworkers, and these sort of things that we wouldn't normally do can again be those pink flags. Physical concerns, headaches, stomach aches, jaw pain, TMJ, grinding our teeth in our sleep, right? This is maybe sending signals that we could benefit from integrating some more relaxation, specifically muscle, progressive muscle relaxation can have a huge impact on those sort of things. And then a reality of increased substance-related coping strategies. So maybe we would have one glass of wine on a Friday night to wind down, but now maybe we're having 2 glasses of wine, or we're finding we need to drink every night or 5 times a week. And we're feeling like it's a necessity to kind of cope with things. And I don't want to shame anybody for using alcohol or drinking alcohol. I also drink alcohol. But just noticing, keeping a bead on it is really helpful. These are the symptoms of depression. As a mental health professional, if I was making a diagnosis, these are the things that I would be looking at. Anhedonia is another way of just a term to describe just losing interest in things we used to really enjoy doing. So if you've got students who loved participating in volleyball, or they really loved video games, now they're like, I just can't get the energy to do that anymore, that could be a sign of anhedonia. Feeling sad for no reason. I think with this last 18, 19 months now, we have a lot to be sad about, right? Like racial injustices, COVID, loss of autonomy in some ways, feeling demoralized. Like these are things that make sense to be sad about. But if it feels like it's for no reason, right, that's not productive or helpful because you can't do anything to grieve that process. Sleep difficulties again. Restlessness, so like I can't sit still, I have to keep moving, otherwise something could happen, or feeling like we're moving in slow motion. And then change in weight without intention. Certainly there can be a correlation between increase of calorie consumption or decrease of calorie consumption and gaining or losing weight. But also there's this really beautiful effect of stress hormones on our body that it actually makes us like retain and build fat reserves and fat stores, food stores, that's a better word. So if we're having an increase of stress, even if we're not quote unquote eating more than we used to, we could be adding a little extra weight to our bodies. Fatigue, feeling worthless or guilty for no reason. Obviously, if you've hurt someone or done something that you probably should make amends for, it makes sense to feel guilty. Difficulty concentrating or making decisions. We can see this a lot with students in coursework. And then thoughts of suicide. So then any questions about those, or they making sense? All right.
Kodee, I was just curious to
Yeah.
know, I've been on campus a long time, and I'm wondering whether you all are seeing more affinity to suicide as a solution. I remember times when we've had a student suicide on our campus, and I'm not aware of any. There may have been some this year, but I'm curious to know whether you all are seeing an increase in at least thoughts of suicide.
Definitely. I don't have the exact numbers in this moment. I can pull those up for you, but we are getting a lot more students who are reporting thoughts of suicide at some point recently. It was a pretty decent amount of lower risk suicidality, like, oh, I really wanted to die sophomore year of high school and I'm a senior now in college and I haven't had those concerns. But a lot more recently we've seen an uptick in people reporting passive thoughts at least. So yeah, I think they're not publicized because they try to be really mindful about the contagion effect. But we have had obviously students who have died by suicide as of this summer. I tend to be part of the conversation if we do lose a student by suicide, and we, as of today, have not, but it happens. So I don't want to pretend like this is lucky or this is great. It's just like, it's a reality that right now it's not happened again. Does that make sense? Maybe a little cynical, but. All right, I want to cover just anxiety symptoms. And again, this is coming from a diagnostic perspective. It's normal to worry. It's normal to have anxiety or to nervousness, but if it's dominating their lives, and if they're not able to do anything else but worry, then it's probably a level of clinical concern. Difficulty controlling that, and the anxiety could be associated with the following: tension in our bodies, easily fatigued, difficulty concentrating, irritability, muscle tension, or I said that right, sorry, sleep disturbances. So there's a lot of overlap between anxiety and depression from a clinical picture, but you don't have to figure that out, right? That is not something you need to worry about. But if you're seeing some of these things in your students, to consider referring them to what would be most helpful. So this next slide is some questions, and I feel like we've done a pretty good job talking about what we've noticed. I'm wondering if folks would take a couple seconds and share how you've responded to what you've noticed. I know Melissa talked about hearing about concerns in one-on-one conversations, and then having a conversation with them. Yeah, and opening the door to that process. Awesome. What about other folks?
I gave my students an assignment on Monday that was about, it's a Spanish for Professions course. And so we talk a lot about professionalism and how that, manifests in different ways and with the Spanish language. And so I gave them an assignment for Monday that was about productivity. And I gave them a little bit of information about how productivity continues going up and wages are stagnating, and a little bit of more information just about how we view productivity in our society. And then I gave them the rest of their assignment was to go and do something completely unproductive. Don't report back to me. Don't tell me anything about it. And I said, and we're not going to have class on Monday. So to facilitate you doing something totally unproductive, I will see you on Wednesday. And so like, just to like show them that like, it's good to be productive. It's also totally okay to not be productive. And I'm going to give you a class period to like facilitate that.
I really like that because it's sort of like, this is a real life application of what I'm asking you to explore. So, good. So recognizing a loss of connection with Zoom, that's a huge reality. Bi-weeks being part of that, awesome. So, and again, want to be mindful of the time. So I'm going to shift forward, but definitely keep conversing in the chat as we go. So just sort of thinking about a typical traditional way of responding to our students. 5 years ago, what would you have done with a student who was crying in your office, talking about feeling like a failure? And you can put this in the chat. I can also offer what I know many faculty do, or advisors even have done when this was happening. Like maybe you feel like you can handle it pretty okay. Yep. Asking them if they feel like they have support. Answer tells you a lot about how to respond. Excellent. Which is also incredibly empowering, right? Because trying to overfunction for students can end up tearing away at their burgeoning self-efficacy, because if we are communicating to them that we don't trust them and their well-being decisions, then how are they going to create trust around it for themselves? Many people, and I think honestly, many people who are not people who attend my presentations with this group regularly, often send somebody to the counseling center for help, which is great. Like we want to be that resource, but there's so many other less intense interventions that can happen that can have as great of an impact. So I offer this as a challenge. It's like sending someone to a surgeon to remove a splinter. Sometimes people just need a good cry, and maybe you're that person that they're sharing it for the first time. Your best friend in dealing and responding to students who are struggling is this, right? It's really easy. Make sure you have tissues in your office if you're seeing people in person. Because lots of times, if you're the first person they're sharing something with, that's not like reportable, right? Like obviously if you're a mandated reporter, you have to go through your process. But if you're the first person they're finally telling, I don't know how to do this anymore, you listening to them and maybe validating and normalizing what they're going through because of not only your lived experience, but how you've been able to help other students like them get to the point of graduation. That's sometimes all that they need. And there's sometimes, right, where we have a faculty member who sends a student to us for therapy, and sometimes they're really appreciative, right? Because in our profession, right, we're very relational. We create space. It's part of our job and our skill set. But there are some students who feel really angry about it. And that to me feels like such a loss and a misstep with a relationship. And we can still hold that frustration, but it's hard because we then can't give the faculty member feedback about that experience. And often this relationship's been ruptured to the point where the student doesn't want to give that feedback either. Now, those faculty are also not often people who follow up with the student after they've made the referral. They're just hoping it's been taken care of. And then I love the point that Melissa, you made of sometimes sharing our own struggles. That can be, again, another way of normalizing it, because we don't have perfect lives, right? Like we deal with things, we've dealt with things poorly, we've dealt with things really well. So giving options of what has been done before can be very grounding for most students. So just want to give you a little bit of overview of how CAPS has shifted in response to some of the increased needs. Some of you may be aware that we have had a very appropriate reputation of being difficult to get in around this time of the semester, and like the dreaded wait list conversation, right? So one thing that I want you to take away from today, if you take nothing else, is that we are not on a wait list. Students can get in for a therapy appointment almost every day for this initial meeting. For individual therapy appointments, we are looking only at the first week in December to get somebody in for ongoing therapy. This is unprecedented. And a lot of that has to do with the fact that we changed our model of service. So it's basically a help at the point of need. To accomplish that, we offer consultation sessions, which are 20 to 30-minute appointments, just to kind of get a broad overview of what the heck's going on and how we can help. And those are first come, first serve, and they're from 8:30 to 3:30. So if you have somebody you think would really benefit from a consultation with us to hear about options, you can let them know that they can come to our office anytime during that day. During those hours. Now, we also still serve urgent crisis situations, so suicidality, homicidality, self-harm, sexual assault, or possible psychosis between the hours of 8 to 5. Again, you don't have to decide if they're urgent or if it's a consult. You can send them to us. How long do they have to wait for consult if they just show up from 8:30 to 3:30? We have been successfully able to see people within 2 hours. At the most. Now, if we have 3 people who come in at 3:30 and we only have 1 consultation appointment available, then the first person who comes in, they're given that priority. We're also going through a screening process where students are asked the 5 risk questions that I just named off. And if they say yes to any of those, they're scheduled with an urgent clinician so that they don't have to wait. But if there's not an appointment available, we encourage them to come back as soon as they can the following day, which is typically our 8:30 to 10:30 spots are going by unfilled because most students don't want to come in that early. And then if somebody tries to come in a second time and they don't get an appointment, they're scheduled for that next follow-up. And definitely always our urgent crisis therapists are available and can do a consultation. So might they just sit there and wait for 2 hours? No. They have the option, I should say. So we say somebody comes in now and the next appointment isn't until 2:30. And so we say, do you want to wait or would you like to come back? And if they say, we'll wait, they just hang out in the waiting room, they do homework, they go to the bathroom, they get food from the vending machine, fill their water bottles, whatever. If they choose to leave, that appointment is still held for them, so they're scheduled. But if they leave and don't come back, there's a $25 no-show charge because it's considered an appointment. So we try to be flexible with the needs of the students. And so far it's worked out really well. And we have, these are growing pains. We just rolled this out at the beginning of the semester. So we're going to do sort of a process reflection at the end of the semester when it happens. So we also have more options for mental health support than we ever did before. We have a pretty basic self-help options, resources that we can refer to students to who are maybe not ready for individual therapy or they're just looking for skills. We have psycho ed workshops that we can refer to, and those are run by our clinicians. Group therapy is not happening right now because all of our groups are full and they're wrapping up for the semester since they're semester long. And then we have individual therapy as an option. But if you have more questions about this, I will definitely talk more with you, but I want to make sure we cover what the point of the presentation is today. But just, you can email me and I'll put my email in the chat. So big piece, bringing the whole student into the curriculum. And I just want to validate everybody for a minute because I recognize that giving meaningful attention to a student's whole being, their academic, social, physical, and mental health can be daunting and off-putting. Most of you were, as content experts, were not trained to integrate these aspects into the content that you're covering. So I just want to validate that because it can be really challenging to think about how am I going to pull this in or how am I going to help my colleagues pull this information in. So there's a field of approach, a theory of pedagogy that is the curriculum infusion. And so at its core, curriculum infusion is prevention. It purposely integrates topics into existing content rather than creating a standalone course. Knowing that students have so much they have to carry for getting their major classes in, if they're doing a minor to get that competency built, creating a class around wellness. I mean, there are other ways that are more holistic for the community that we can integrate that. So the Kinney and Grimm article from 2015 focused specifically on alcohol abuse into courses. So I've got references at the end, so I'd encourage you to look at what that might look like. So these are just some examples, like non-math or non-major mathematics course integrating the impact of alcohol or caffeine on the body, or a neuropsych course talking about sleep deprivation on our brain and body. Like these things people are probably already doing aspects of, but to really take ownership of it and to create space for it. And I'm just sort of thinking to throw this out to all of you, knowing that you might just be introduced to this topic for the first time ever as curriculum infusion. But what do you think are some benefits and drawbacks of this sort of approach to well-being for our students?
Kodee, I will say I do worry a teeny bit about thinking of different colleagues about the implementation.
Yeah.
So I think it's, you kind of understanding where the limits of your expertise are and the boundaries of the guidance and resources you can provide. I am a little bit worried about some people feeling like they're doing more than they are and potentially suggesting to students that what they're doing is more than it is.
Yeah, that's a really good point. And that is why, if this were something that folks wanted to do, it would need to become a conversation for sure. Yeah, but you make a really good point, Dawn. Thank you. Yeah. What about other thoughts? Benefits normalizes issues, prevention's easier than intervention, true story. Drawbacks could be triggering for students. Yeah, possibly. How might you increase awareness about that possibility for a student? And this doesn't have to just be from Melissa if other people have thoughts.
I will say that I discussed the issues of trigger warnings in the Principal's College teaching class last week. So this has been on my mind a little bit. Mm-hmm. And as Melissa's pointing out, one of the issues with the trigger warning is a trigger warning might actually create the response that you didn't want to have in the first place. Mm-hmm. And I kind of think in terms of probability and possibility. And for me, at least in my personal experience, giving the warning, providing the information is better than not. Mm-hmm. And there are downsides for both. But I just find that letting students know what the situation is, letting students know what could happen is better than not doing those things. And it doesn't mean it'll always work right, but it's something that I would take that calculated risk for myself.
Mm-hmm, mm-hmm. Yeah. And I think another way to kind of rephrase my question would be to ask, could you give the student the information without sort of creating this availability heuristic so that they know what they're getting into without assuming that it's going to become problematic? So like, these are the expectations of the course. These are some of the topics we might cover. Is this something you would be interested in participating in? Right. So having it in the course description, maybe sending a syllabus out early to your advisors to talk with them, especially if your advisors are the people who connect the most frequently, your professional advisors who aren't faculty connecting most often with students. So, yeah. All right. So I have two real life examples. So there's Georgetown's Engelhard project. I don't know if I'm saying that right. So if anybody knows, jump in. So for connecting life and learning. And this, again, was to take the experiential components that most people aspire to integrating into their coursework and creating real world, oops, that's a typo, sorry, real world application of the curriculum. So with this kind of project, they, across the board, they've integrated in different programs or courses, depression, anxiety, eating disorders, flourishing, belonging, adjusting to college, substance use, and coping with stress. And it was a huge collaboration between mental health providers in the university, the Teaching and Learning Center at Georgetown, and then faculty and staff who feel like they have a pretty good sense of how to respond and support students in a meaningful way. So it's not just grabbing some random person who teaches a class and being like, how would you infuse this in there? But being aware of what those options could look like. And then also the University of Buffalo. And the article does not name University of Buffalo, but I happen to know where Sharon Mitchell, who's the author, and the other folks who were part of this are affiliated with, but they implemented this back in 2017 to spring 2011. It's a little unclear if it's still happening, but they just have some metrics. So I'd encourage you to check out this article from the reference page that I can offer. So this again was mental health professionals recruiting faculty members across disciplines to integrate mental wellness into their courses. And so the classes that they picked and partnered with were like applied marketing, choreography, media design, and visual studies. And I love the creativity that comes along with these aspects, because as a psychologist who's a clinician, I don't think about applied marketing, right? Like maybe from drama therapy adjacent interactions, I could imagine choreography being part of it, but definitely things like media design. So I love the opportunity to partner in really meaningful ways across disciplines. And in general, the results suggested increased self-efficacy for the faculty themselves without a noticeable increase in referrals to the counseling center. And why this matters is because if you have your ear to the ground on mental wellness on college campuses, you will be seeing frequently that demand regularly outstrips resources for university counseling centers. So that students are being supportive and created maybe their own wellness process. And it's not meaning that more students are having to rely on the counseling center. Supports this idea of integrating across disciplines can make a big difference at just a whole holistic well-being. So. Yes, I definitely, these are my long-term aspirations, Melissa. So this is what I'm hoping we can accomplish at some point as just a community of folks. So some of the key findings. So this is where we kind of help to ground faculty who are interested in this process. So commit to a topic around mental wellness or holistic well-being. So don't try to cover sleep, depression, and assertiveness. Pick one thing that you feel like you could easily integrate into a course that you're teaching. And once you choose a topic, the 3 engagement components are going to be really essential. So relevant readings, you might have to dig for it. And you could also use your professional resources like myself or other clinicians if you want to get some grounding in those places to integrate those tasks to your course. Discussion with campus resource professionals. And this looks like really simply setting aside a day where maybe members from our Morrison Family Center for Student Wellbeing, associated with Lafine and Health Center and CAPS, can go and do a presentation to your class about the topic that you've selected. We have an eating disorder specialist on staff. We also have a dietitian that works with eating disorders and a medical provider who treats eating disorders. So if you feel like this could be an area worth exploring, you could invite those people into your space. If you want to talk about sleep and sleep hygiene, we have competent folks. We make this a lot of times a part of our treatment plans with clients. If you want to focus on alcohol consumption, we have an alcohol and other drug education specialist who can come in and talk to your class about, what happens when you drink alcohol, when you use and abuse cannabis, and what are the long-term implications for that. And then the essential pieces like student written reflections, which sometimes maybe it's the last thing we want to look at because it's just another assignment. And maybe our style is not to review journal entries from students. But the whole point of it is like, what does it actually mean to them? Because if they're just regurgitating what they've been told rather than applying it to their own life, they're missing the importance of it. And that could be a need for an adjustment on the faculty's part. It could be a need for an adjustment on the campus professionals' part. It could be a need for an adjustment on the student part, or some combination of all 3. So, but you won't know that until you ask the questions. So yes, journaling definitely can help with stress and anxiety. All right, so being part of the solution, this is all of you and your colleagues who might be interested in it. Possible outcomes based on the literature that I reviewed for this. Empowering students, so helping them access internal resources and overall resilience through reflection. This is really important when we think a little bit about learned helplessness. So for some reason, my partner's an advisor in the psych department and also has a background in psychology and mental health therapy as well. And we were just sort of bantering about just how much the students are struggling right now. And it seems disproportionate to what we've had in the past. And it made me think of like the learned helplessness studies with the little puppies. And I cannot remember who did it. Don, I'm looking at your screen. I don't know if you can jump in and help with this, but like who did it?
It was Seligman.
Thank you. So basically, like, right, you put puppies in this space and you shock them, and some puppies have a way to get out and they can get out. Other puppies aren't allowed to get out. And then you're still shocking them. And then when you give the puppies who are shocked with no way to get out a way to get out and shock them, they don't leave. Learned helplessness. I can't do anything to change this for myself. I don't know what to do. I will just continue to sit here and hope someone will rescue me. So we don't want that. We don't want to perpetuate learned helplessness. So empowerment is going to be really important. Increased awareness of resources for yourself and the students, from tweezers up to the surgeon. Increasing prevention health efforts, so helping students see pink flags within themselves and others, you seeing it as well. Increased participation in wellness campaigns. So if they're like, oh, I have this knowledge and awareness about how important sleep is, and this event is happening, or I want to be involved in this student organization, or I want to do something to make a change by using this knowledge that I've learned from your course to accomplish that. And then you also can have the benefit of seeing the student as a whole person. I know I've had a range of professors, right, when I was in undergrad in my master's program, where they knew that I had a life outside of class. They still had expectations for me, but they didn't, but they weren't, I wasn't their own, they weren't the only thing I was doing. And I was much more willing to engage with them in their courses than I was people who just like, I'm at the Elmo drawing a connection on the page and don't even look up and see if a person's raised their hand. So also ages myself mid-30s, yay, to talk about professors using an Elmo. So, all right. The next question is, what will this look like for you? And this is what the document in the chat box is for. So I noticed that somebody had shared that they had difficulty accessing it. I cannot remember. Had that been resolved for you, person who shared that? Something
it hasn't. Maybe it's just me. I haven't been able to open it from there.
Let me go ahead and open it and share it on my screen. All right, thanks, Carol. Okay, so we're
I
not.
wasn't sure if it was a handout or.
Oh no, I'm getting an alert that it didn't work either. So
okay,
we will email this out. I guess I volunteered you, Don. Can we email this out?
Oh, yes, absolutely. Sorry.
Oh, you're okay. You're okay.
I didn't think that was a question. We can do that. That's fine.
That's fair. All right, I'm going to share this. Okay, so this is what the document will look like. And think of this as, if you're interested or intrigued by this idea, how might you start making a plan for yourself? So questions, just a self-reflection, right? Another big thing that I like is, because I supervise our pre-doctoral interns in health service psychology, and I do a lot of work around diversity, anti-racism work, uprooting white supremacy. And so my approach to those sort of things, whatever they are, is that I don't want to ask somebody else to do something I'm not willing to do myself. So these are your journal exercises. What issues have your students shared with you the most? Another thought is like, what's your favorite class to teach, or what's your favorite thing to do educationally related? Then what efforts have you already made to increase experiential learning in your courses? Because that's going to be an important aspect of the curriculum infusion if you, again, are intrigued and interested. And then sort of like a plan based on your current experiential learning concepts. Here's how I would integrate commonly reported concerns into my favorite course. And the big thing being committing to a topic. So these options below are what we talked about in the slide, right? Relevant readings, inviting campus partners, and how are you going to have students reflect on their process? So I'm just wondering if folks have any initial reactions to this. We have like 4 minutes left. This is not an end all be all, by the way.
The thing that sticks out to me here, Kodee, is that it's a very nice integrated approach that provides support to the instructor who's doing it. So they don't have to do all the things. They're going to use relevant readings. They're going to use people who know, and then they're going to kind of have their students engage in the process too. So I think it's very nice that it spreads the work onto the people who are most able to do it.
Mhm, mhm. I'm going to stop sharing so I can see all your faces. I'm also curious about folks' reactions. Like, could be a range from like full rejection to curiosity, to maybe really feeling yourself motivated as you look forward to spring semester at trying some of this stuff out. Emily, I like the idea of devoting a day to the topic. Shows you're willing to prioritize student well-being and not just talk about it. Yep, it's a great point. Any other thoughts?
I was just going to type this, but then I decided it was going to take too long to type. I really appreciate the solution or strategy focused approach, because I think we talk a lot about needing to practice self-care, and we put a lot of that responsibility on the individual, and it often feels like a lot of lip service, especially in the culture of academia and the expectations that are placed on people. And so there's this split between what you should do and what you actually are able to do based off of that culture. And so I like that this is integrating and providing solutions to that instead of just kind of talking around the systems that are involved.
Yeah, thanks, Summer. I'm glad that you did unmute and share that. Yeah, thanks, Jessica. So, well, I'm noticing people like the time and people probably need to sign off. So I'm going to put my email in the chat. If you have more questions or want to talk more about this or just want to understand what else is happening at CAPS right now, do not hesitate to reach out to me. I love informal meetings. So if you ever want to grab coffee, like I will meet you where you want to. So
I'd like to remind you all that if you're coming to these for part of our professional development series to get a certificate or to potentially become a fellow at the TLC, we'll have a post-event survey available for you. If you're watching this later, we have this available for asynchronous viewing, so tell your colleagues about it. And for those of you watching it later, hey, it was great to have you at this event. And finally, in 2 weeks from now, not next week, because next week we're all taking a break. 2 weeks from now, we have Fred Burak from our Director of Assessment, who's going to be talking about assessment in our classes. So finally, and not least at all, is please help me thank Dr. Kodee Walls for coming and sharing her expertise about how we can guide our students to a better well-being. Thank you, Dr. Walls.
thank you so much. I appreciate it. It was good to see all of you. All right. Everybody take care.
We'll see you all next time.
Yes. All right. Have a good one, Don.
Bye, all.
Thanks.